Welcome to Healthier, Happier You, the people working to make it happen. I'm Evan J. Cholfin from Luxhammer, where we help the brands that help you live healthier. Today I'm joined by Scott Hatfield, President and CEO of WikiPouch, a company transforming infection prevention in healthcare facilities. Scott, welcome.
Thank you. Glad to be here.
Glad to have you. So, what's the origin story behind WikiPouch?
The origin story behind it, I've been an entrepreneurial figure all my life, a number of different things. My stepsister, Meredith Lloyd, actually was working in a nursing home and she got put in charge of infection control. She's noticed they're storing nasal cannulas and nebulizers in plastic bags. She goes, this can't be good. So she went and got some breathable material, sewed them up, and there was a reduction in infections. I had a little bit of an opening. I wasn't sure how great the product was going to be, but she said it was great. I went to Chico State University in Northern California. We did some tests on plastic bags versus a breathable moisture-wicking bag, and the rest is history. We've built a company out of it. Things are going quite well. We sell through all the major distributors to nursing homes and hospitals, and it's amazing. Frankly, it's just amazing how much bacteria reduction takes place when you use a breathable moisture wicking bag versus a regular polyethylene plastic bag.
And maybe you could talk a little bit about what makes WikiPouch's moisture wicking technology unique in preventing infections.
It's a polypropylene type material. It's a non-woven material, kind of like a lot of the types of material that maybe even your bicyclists will wear. So moisture wicking, it dries quickly. But it is also the same material made out of face masks, the breathable material that they wear for face masks in surgical sites and hospitals and so on. When we tested the product at Chico State, what we noticed was in the plastic bag, the moisture stayed on the nasal cannula or the nebulizer. And in fact, in many cases, grew the bacteria inside the bag, not to mention even on the outside of the bag. While it was put in the WikiPouch, it reduced the moisture, thus killing the bacteria inside the bag. It's really just a moisture wicking bag that allows the air to breathe through. It is hydrophobic material, so it doesn't like water, doesn't like moisture at all. And whatever is in the bag, it simply dries it out.
That's great. So maybe you could explain to the audience a little bit, what core problem are you solving for healthcare facilities?
So the biggest problem, and of course this started with my sister contacting me on this issue, was the typical in the common practice in healthcare facilities is to store a patient's reusable nasal cannula, nebulizer, even a BiPAP, CPAP, in a plastic bag between use. So they take a shower, they go to lunch, etc. They store it in there and then they pull it out and put it back in. And not only does it cause infections that the plastic bag can easily be infected by other bacteria, which can get on the nasal cannula, which then goes into the nose, which is the most vulnerable part on our whole body to infections. It also causes the bacteria to spread to other facilities when the nurses handle it and the nurses touch it. When I say other facilities, I mean other rooms, other patients, and the like, and it just spreads. It's really typical in hospitals. They do breathing treatments, for example. And those breathing treatments are for pneumonia, COPD, and other types of respiratory issues. Pneumonia is the biggest problem that there is with it. But they'll give a patient a breathing treatment every 5 hours for 3 to 5 days. If they have pneumonia, let's just use that as an example. And they'll store the nebulizer inside a plastic bag in between use. So every 5 hours for 3 to 5 days, the nebulizer is pneumonia laden, right? And it causes the bacteria to spread and grow inside the plastic bag, which then causes it to spread throughout other parts of the hospital, which my argument is that's causing nosocomial or healthcare acquired infections throughout the facility.
Yeah. You mentioned that the WikiPouch helps prevent that from happening. Maybe you could just explain a little bit more.
So the plastic bag, again, allows the bacteria to grow and spread. We like survive and spread. It loves polyethylene plastic, the bacteria. So even on the outside of the bag, so if you touch the bag and move the bag and then you touch somebody else, or you don't wash your hands perfectly like you're supposed to, you can actually spread it throughout the facility. The WikiPouch, when the nebulizer is put in there, within an hour, it dries almost completely, or even less than that. At Chico State University, when we tested, we inoculated nasal cannula with the Staphylococcus epidermidis, and it basically lost 800% of what it was in the WikiPouch versus plastic bag. In the plastic bag, it actually grew a little. But in that period of time, there was an 800% reduction. And so when you have a nebulizer that are given to a pneumonia patient breathing, and then you store it inside a plastic bag waiting for another 5 hours, you're growing and spreading it. Whereas if it's in the WikiPouch, it'll dry out, even on the outside of the bag, because it's hydrophobic material. It doesn't allow it to spread. The bacteria simply dies naturally. And that's how you keep from spreading the bacteria throughout the facility. It's really simple. When we tested at Chico State University, we tested a whole variety of different materials, paper, for instance, cotton, and the moisture-wicking material of the spun-bond polypropylene material, along with some other additives when we manufacture it, allows it to very simply wick the moisture off of whatever's inside. Now, a lot of individuals say, well, is it antimicrobial? Does it have an antimicrobial agent in it? No, it's just a moisture wicking. And an antimicrobial, which we also tested, didn't reduce the bacteria on the nasal cannula nebulizer any better, because in order for an antimicrobial to kill the bacteria, it has to touch it. Well, a lot of times your nasal cannula, it's got holes in, the nasal cannula or even in the nebulizer. And unless the antimicrobial agent touches it, it's not going to kill it anyway. So the best way to reduce the bacteria in a healthcare setting is not to store a reusable respiratory device in a plastic bag, but in a moisture-reducing breathable bag. The Wiki.
Oh, that's great. So, where are you focusing most of your energy in the business right now?
Right now, we're mostly focusing for our nursing homes, rehab facilities. They utilize more of our products than, say, the hospitals do. It's really difficult to break into the hospitals. I don't know if, like I said, the product's too simple. We've worked with a lot of hospitals. We have a few of them, and they buy a lot of products, and they love the WikiPouch. They buy both the black and the blue one. But our main focus is nursing homes, rehab facilities, care facilities, long-term care facilities. We have a variety of products that they use for that. But it was all started from reducing infections from the use of plastic bags. So really that's the bottom line, is the WikiPouch reduces infections compared to the use of plastic bags, because the plastic bags are just so horrid to use in this type of setting. And so all of our sales, I'd say 90% of our sales are for nursing homes. But we are working in the hospital arena a little, trying to get the bureaucratic mess, if you will, to get in there. We've offered all hospitals that we talk to, we offer free product for them to test. We've only got a very, very few to test our product out of all the hospitals that we've offered free product to. And it's upwards to 100 different hospitals. So just try it, have a look at it. And the bottom line is, one of the things I say is, I'm not getting any younger, and I think about going into a hospital that's using plastic bags to store my nebulizer. That scares me a little bit. Really, it's hard for me to believe that hospitals continue to use plastic bags to store pneumonia-laden nebulizers. What's also interesting in the hospital world and in the nursing home world, but hospitals, every single nurse that we've talked to over the course of 14 years, or 12 years anyway, selling the product, they all agree that plastic bags are not good for storing reusable respiratory devices. But when they take it up the chain to get them to purchase our product, and the hospitals in particular, it falls short. The nursing homes have more autonomy to make decisions like this. And of course, their job is to take care of the patient fully, not necessarily deal with it in such an acute setting, but to take care of the patient long term. But still, it's storing reusable respiratory devices in plastic bags is just a bad idea.
Why do you think that it's falling short once it's going up the food chain?
That's a great question. Why aren't hospitals testing our WikiPouch when I offer them free to every single hospital throughout the country? It might be because the technology is so simple. Like I said, it's hard for me to believe that they wouldn't try it, at least. The fact that they're using plastic bags, and you've got studies on how bad polyethylene plastic is for bacteria growth. You got the Journal of Clinical Microbiology that did a study a little over 20 years ago talking about polyethylene plastic being the worst material in a healthcare setting for bacterial growth and adherence. Why they don't want to test it, I think partly is also the government doesn't mandate it. I don't know if I want it to be mandated. I think common sense should win the day. I don't think we need to have mandates all the time. You should just be able to use the common sense, but there's that issue. But I think the simplicity might be it. I'm also concerned as it goes up the flagpole, so to speak, to the C-level, the management level. What are the reasons for that? If we reduce infections, is that a problem? Because the numbers are pretty staggering just through the United States that 2 million people each year acquire nosocomial or healthcare acquired infections in hospitals. 100,000 of those people die. And pneumonia is number one. Looked it up on the CDC's website as far as killing patients. The average fee that they collect when a person gets a secondary infection, as I like to call them, or a healthcare acquired. In other words, they didn't have it when they went to the hospital. We're talking $43,000 to $50,000 per patient to take care of them. And of course, unfortunately, some of them die. That's just pneumonia. That's from the report that I got on the CDC website. So it's a tough question as to why, but I think we were at a trade show and 40 different hospitals came up. It was an APIC trade show up in Portland, Oregon. And 40 different people came up and go, I knew plastic bags were a problem. What were their titles? Infection control, respiratory. These people have the titles of infection control and respiratory. And I've sent samples to UC Davis, UC San Francisco, UC Irvine, and a number of different facilities. Like I said, about 100 different facilities. And they all said, I knew it. This is a problem. When I sent them all a large sample pack to just have a look at them, I offered every single one of them at that trade show, all 40 locations, all the product they want to test for free. Guess how many out of those 40 took me up on the offer?
How many?
0. And I don't know why. Now, we do have some hospitals. There's one in Silicon Valley, El Camino Hospital. It's been using our product for quite a while. We've got a big facility in Alabama, and we've got several on the East Coast utilizing our product. So we've got about 15, 16 hospitals using it. But it should be more because it really will reduce healthcare acquired infections that spread from the use of plastic bags.
You think some of it might be a social proof issue? Maybe having some big doctors or something supporting and saying that this should be mandated in every hospital or something along those lines.
That's a great question. I have noticed that in the medical field, individuals, they're pretty confident, let's put it that way, on their understanding. And I was at a show one time and I said, look, I'm just a business guy. I'm not from the medical field. I says, but it's dumbfounding to me that you all store reusable respiratory devices in plastic bags between use. I said, I don't get that. And one of the nurses looked at me and said, well, until your product came around, there was nothing else to utilize. I said, okay, well, I guess that's an okay statement, but I think my argument would be, I think it's better if it falls on the floor. They clean the floors every day, and And I'm going, the plastic bags are worse than it just sitting out in the air. But now the WikiPouch actually draws the moisture out. We had a nurse asked me if I could make a small one for the toothbrush to hold and it amazes me because I said, sure, I could make them. And we sold, 5,000-10,000 of them. And I went, maybe I ought to try that. So I put one of them up in my bathroom. I've been using it now for the last 6 years. It's amazing when you drop the toothbrush in the WikiPouch, how much moisture it pulls off the bristles for the next time you brush your teeth. I mean, you can feel it. The bristles are stiffer. It's almost like using a brand new toothbrush. That's the same thing it does to the nasal cannulas, nebulizers, and other respiratory devices.
Yeah, I need that for my toothbrushes at home.
Well, I'll send you some. Give me your address and
Sounds
I'll send you some. Yeah, we sell quite a few of those and a lot of them to nursing homes as well. But yeah, the WikiPouch, it's a good product.
So, also, one of the things that I'm curious about, the more hospitals that you do sell to, having that social proof may also be helpful in convincing more hospitals, if that makes sense.
Absolutely. In fact, one of the interesting things is we needed a clinical trial. I've offered free product for a year, free. If I could get them to give me a clinical trial. I call them field trials with the nursing homes where they tested our bag. This was done 10 years ago compared to plastic bags, and the respiratory reductions were 60%. 60% compared to the use of plastic bags. That's amazing. So in the hospitals that we've tested, like I said, one of them was in Alabama, and they've been buying our product now for the last 7 years, every month. And they tested the bag and they had some data for us. And I said, can I share this data? And they said no, because that was their private data. I understand that. At El Camino Hospital in the Silicon Valley, we tested theirs. They liked the product. The data that they came back from, it was a little inconclusive, but they still like the bags, and they've been using the WikiPouch now for the last year and a half. So people love the WikiPouch when they start using it. Getting them to use it in the hospitals is, I think, maybe more difficult just from a bureaucratic standpoint, or from I wish I had a better answer on the hospitals, but why they're not wanting to use it when they're given away free to test and to check. But you're right. I think a clinical trial with the data, but even then, I'm not 100% sure. If the government isn't going to mandate it, which again, I don't want that, but I don't think a lot of healthcare facilities necessarily worry about other products that might reduce things if the government's not behind it, per se, I guess I would say. And that might be another issue there.
Yeah, for sure. What are your main growth targets for this year?
Well, we're doing well again in the nursing home arena. Our growth targets, we try to grow anywhere about 50% a year. Prior to the pandemic, we were knocking it out of the park. You know, we were on our way to major numbers, $1 million a year in selling these bags, you know, which is the average price is like $1.10, $1.25, something like that. That tells you how many people are using the bag. But during the pandemic, the nursing home got hit really hard. We lost a lot of our patients, obviously. They died. Nurses left. Doctors died. It was the pandemic. I know it was horrific on a lot of areas. I know that. But it was very horrific in the nursing home world. It's growing back. We're almost back to pre-pandemic levels because of some marketing, but it mostly has to do with just more and more people getting back in the facilities. I think there's 15,000 nursing homes nationwide, about 7,000 hospitals, give or take, depending on their expertise. And I think we've got a little over 1,000 nursing homes, maybe 1,500 nursing homes currently buying and using our products. So our target would be like to get up to 30% of the market. Numbers are increasing nicely. We appreciate that, not only from the business standpoint, but more people are going to be healthier from the use. I know it sounds silly, but it's a horrendous practice to store an older person's, or even a pneumonia laden or a sick person, to store their respiratory device inside a plastic bag. That's just a horrible practice. Now, I'm not saying the WikiPouch is the greatest thing since sliced bread, but plastic bags are the worst thing you could possibly do.
So, how are you currently acquiring most of your new facility partners?
We mostly just send out a mailer, but most of our products are sold through distributors, Medline, McKesson, TwinMed, and a host of others. Through distributors, that's the best way to do it. And that's what we really want to focus on as our distributors. But the facilities need to hear about it. So we'll send out mailers, just an awareness campaign, letting people know that there's an alternative to plastic bags. And plastic bags cause infections in healthcare, bottom line. And so we get calls directly. We send out free samples. If they're a hospital, we'll send out all they want to test. We'll send out free samples. They test them, they try them, they love them, and they continue to buy them. Because our products, the WikiPouch lasts for 30 days per patient or PRN. After 30 days, it's to be discarded. So that's the typical usage in the nursing homes. Hospitals, obviously, per patient. If the person's out in 5 days, that's it. But mailers, and then we're going to start doing a little bit more of an aggressive campaign, say starting in September, maybe with some emails, phone calls, and some other social media marketing. That seems to be the best way to do it. We've tried it in a lot of different ways, but the best seems to be just simple, old-fashioned mailers. Nice advertisements that go to the facility, they look at it, they determine whether or not they want it. If it gets in the right hand, because like I said, every nurse we ever talked to said they know that plastic bags are not a good idea, but trying to get it bought up the food chain is difficult for them sometimes. But nursing homes are a little easier to get.
Yeah, definitely. I'm curious, just in general, what trends in healthcare are exciting you these days?
That's an interesting question, a trend. Well, there is a lot of technology trying to reduce the infection rates in hospitals and nursing homes. A lot of them are really high tech, like those big machines that come in and run the black light or whatever to disinfect a room. Those are neat, but they're really expensive and they take a lot of time. They're using our product and we are growing at a substantial rate. So I guess that's exciting as far as a trend in healthcare. The nurses spend a lot of time really caring for the patients. I mean, after the pandemic, that was a hard hit in the medical field. It was difficult. A lot of them are coming back now. That's a nice trend. The care they have. And of course, infection prevention is top of mind, mainly because of the pandemic now, but it always really has been. Because, imagine a loved one going in for a common little operation in a hospital. Nothing a big deal, maybe broken bone or whatever, or maybe they have a respiratory issue. They catch pneumonia and they die. That's a very heart-wrenching issue for families to have to deal with. And so I'm hoping and I believe that they're making strides to reduce these kind of infections. They've talked about even doing different kind of curtains that will repel the bacteria and doesn't allow it. There's a number of different things, but maybe not fast enough for me. I've only got a few more years before I'll end up in there.
Well, what do you think will be crucial to get right in the next year for you?
Making sure that our awareness throughout the whole United States, that's our primary focus. We're not outside the United States. We do have a patent on our products. We received 4 of our 5 products received a patent. So that's exciting. We just need to continue to, such as we're talking here, plastic bags. That's the problem. We tested at least 12 different materials at Chico State University, and the bag that we came up with performed the best by far when it came to reducing the bacteria that was on the nasal cannula inside the bag. So that's where we're going to continue focusing and get that message out there that the WikiPouch, simply by being a moisture-wicking breathable device, reduces bacteria. And if you reduce the bacteria, what else do you reduce? You reduce the spread of the bacteria. And that's just the message that we have to get out and continue to push out.
Yeah, definitely. So if we had this conversation in 12 months, what would you say made you feel it's been a successful year?
Another maybe 100% growth. So maybe another 1,000 nursing homes. That's what I'm looking for. Another 1,000 nursing homes. And I'd sure like to get upwards to 20 to 50 hospitals at least testing the product and utilizing the product. And the most important thing that I would like from a hospital is someone like a Kaiser Permanente to test the product Run the numbers. There's one of the things that the hospital did, and this is really important. There's a product called an FTP wand. I think I'm saying it right. FTP. Yeah, FTP. And they run that wand on your hand to make sure you're washing your hands, because it'll tell you that how much bacteria is on there. It doesn't necessarily break it down on what type. Well, one of the hospitals that we had down in the Bay Area took the wand and ran it across the plastic bag that they were storing the nebulizer in. And they were shocked at the amount of bacteria on the bag. So those are the kind of things that would be nice for hospitals is check. Is take your FTP wand, check it on the plastic bag, and they'll be shocked at the live bacteria that's sitting right there on the plastic bag, not only on the inside, but it actually grows on the outside. And that's really the main issue. So if we can get a hospital to do those kind of tests and to share their clinical data, that would be a big win in 12 months. I'd love to be able to talk to you in 12 months and say, yeah, we've got 10 hospitals that did some clinical trials and this was the data. And that's the information we'd like to share with the medical public, if you will.
Absolutely. Well, I hope that all happens and that will continue to help you grow your company. That's it for today's episode of Healthier, Happier You, the people working to make it happen. Huge thank you to Scott Hatfield for sharing his insights and amazing work WikiPouch is doing to help people live healthier, happier lives. If you enjoyed this conversation, make sure to subscribe, leave a review, and share it with someone who could benefit. And if you're a brand or business making impact in health, wellness, or personal care, we'd love to help you grow. Connect with me at luxhammer.com. Thanks for listening. Until next time, stay healthy, stay happy, and keep making a difference.